This is the day the Lord has made. I will rejoice and be glad in it. Welcome to the last lecture in our series of 6 lectures on the reproductive system. And this is the last lecture of anatomy and physiology. Congratulations, you made it to the end. You are a winner. Whoop! A whole year of human anatomy and physiology. Look what you did. Way to go, team. Way to go. Let's get this done. So let's look at regulation of female reproduction. This is where it gets tricky. So hang on to your hats. This is going to be a ride. So remember that we've talked about the ovarian cycle, and we've also talked about a little bit about menstruation. But when we look at establishing the ovarian cycle, which is going to drive menstruation, the uterine cycle. So think about the different stages of development of the follicles, especially of that dominant follicle, which eventually is going to burst through the ovarian wall and release the ova. So when we look at this, before puberty, there's going to be a little bit of estrogen, and for females, mainly just to inhibit the release of gonadotropin releasing hormone. But when puberty starts getting close and the leptin levels are adequate, then the hypothalamus is going to become less sensitive to estrogen, and gonadotropin releasing hormone is released. And remember, that's from the hypothalamus, and that's going to stimulate the anterior pituitary to release follicle stimulating hormone and luteinizing hormone. And then these are going to work on the ovaries. What does follicle stimulating hormone do? It stimulates the follicles to grow, thus the name. What about luteinizing hormone? Luteinizing hormone is going to help the dominant ova to, or follicle to develop and mature, and it is going to cause ovulation to take place. And so once this pattern gets established, then we're going to see menarche, M-E-N-A-R-C-H-E, menarche. And menarche is the name that we give to the first menses. So the first time that a girl has menstruation, bleeds, that is menarche, and that is the beginning of setting up the adult cycle for reproduction. In many societies, this is a reason of celebration, and that a little girl is now a woman, even though her body is not mature enough yet to support pregnancy. So once again, GnR stimulates FSH and LH. FSH and LH stimulate the follicle to grow, mature, and secrete sex hormones. FSH stimulates the granulosa cells to release estrogen. LH is going to stimulate the thecal, T-H-E-C-A-L, thecal cells to produce androgens, which the granulosa cells convert into estrogens. Got it? Yeah, you got this. So here's our little happy little picture. Okay, so increased estrogens, positive feedback causes LH to surge, and that's going to cause ovulation. The corpus luteum will produce progesterone, estrogen, and inhibins, and that will inhibit the production of follicle stimulating hormone and LH. Okay, so here we go. Negative feedback, okay, is going to inhibit gonadotropin. Well, that's the way it works in the males. It's the way it works in the females. Inhibit is going to inhibit FSH. Okay. Increasing levels of estrogen is going to inhibit FSH and LH. Okay. We have positive feedback that stimulates gonadotropin release. So estrogen levels rise as a result of continued release by the dominant follicle. And when those levels reach a certain concentration, there's a positive feedback, and that triggers the anterior pituitary, and that's going to trigger the LH surge. The LH surge triggers ovulation and formation of the corpus luteum. What does corpus luteum do? It is going to cause production of progesterone. All right, so LH is going to trigger the primary oocyte to complete meiosis 1 and become the secondary oocyte. Remember that the secondary oocyte stops at metaphase 2 until the sperm penetrates the ova, and that triggers the completion of meiosis 2 and the formation of the ova, the gamete, and a polar body. Okay, so other things that LH does, it increases vascular permeability. Okay, that triggers an inflammatory response, which is going to cause enzymes to start breaking down the ovarian wall. It will then, that will stop blood flow from the follicle wall. That causes the wall to thin, to bulge, to rupture, and the oocyte, surrounded by granulosa cells, that group of granulosa cells are called the corona radiata. Corona means crown, radiata means radiate or around the radius, the circumference. So it's completely covered in these follicular cells, granulosa cells, and that is ovulation. Some women feel that, and they know when they ovulate. They can feel the pain. Others may feel pain and or spot with blood a little bit. It just says, woohoo, you're cleared to get pregnant. And this is the time that if you want to get pregnant, this is the time to have sex. If you don't want to get pregnant, don't have sex. It's that simple. After ovulation, we see estrogen begin to decline. Okay, corpus luteum activates. It starts to secrete progesterone and some estrogen. So the progesterone is going to maintain the functional layer. All right. If implantation takes place, then that little embryo, that little clump of cells is going to stimulate, is going to release hormones that will stimulate progesterone production by the corpus luteum. If implantation does not take place, then the corpus luteum degrades and menstruation takes place. Okay, so we already talked about negative feedback. When the corpus luteum degenerates, it's because the LH levels have started to fall off, and you get this big decrease of estrogen and progesterone. That's going to block FSH and LH. And so what we see is that when this takes place, then the functional layer is going to start to degrade. And that leads to sloughing, S-L-O-U-G-H-I-N-G, sloughing off of the functional layer. Okay. It's really interesting that the oocyte is activated a year before ovulation, but it matures 14 days before ovulation. That's wild, isn't it? It's activated a year in advance, but it doesn't mature, okay, reach full maturity, ready to activate until 14 days before ovulation. So we spent a lot of time talking about the ovarian cycle, and you have to understand the ovarian cycle in order to understand the uterine cycle, or what we call the menstrual cycle. The uterine cycle, you have changes to the endometrium, and it's 3 phases. Day 1 is the beginning of bleeding. Day 1 is when the first day you start to bleed. All right, so if you're keeping track on your calendar of when your periods are, which you need to do so you know you're having them regularly and you don't have surprises, then day 1 is the beginning of menses. So I know your book says it's like day 1 through 5. Some women it's 3 days, some women it's 8 or 9 days. It really depends on the woman. But on average, over all the billions of women, it's usually about 5 days. Day 6 is the beginning of the proliferative phase, where the functional layer begins to proliferate, grow back, regenerate. And then day 15 to 28, you have the secretory phase, and this is talking about secreting hormones. This is after ovulation. After ovulation. Do you remember when we talked about the luteal phase is always 14 days after ovulation? Okay? So keep that in mind. Now remember, some women don't have 28-day cycles. It may be 26. It may be 32. Every woman's a little different, but this is our best understanding of what's taking place on an average. Okay? So during menses, all the ovarian hormones are at their lowest level. That's why we feel down, because estrogen is our feel-good hormone, and it's at its lowest level and we don't feel good. Plus, we're leaking blood. It's really nasty. And sometimes there are cramps. Some women have severe cramping. If you have cramping to the point where you have to be in bed, then you need to go see a gynecologist and get medication, because you shouldn't have that much pain. Notice that during menstruation, the gonadotropin levels begin to rise. The stratum functionalis, or the functional layer, detaches and is shed. It's going to last 3 to 5 days. Some women a little bit longer, some women a little bit shorter. By day 5, the next ovarian set of ovarian follicles begin to start producing estrogen, and we have the proliferative phase. So the estrogen levels are going to prompt generation of a new functionalis. It's going to thicken, the glands are going to enlarge, the spiral arteries are coming back. So it's proliferating, it's regenerating. Estrogen increases the synthesis of progesterone receptors in the endometrium. It thins out the thick, sticky cervical mucus This is to help facilitate sperm. Ovulation occurs at the end of the proliferative phase around day 14. What we do know is that the mucus thins out usually around day 13, 14, 15. Okay, those are your 3 days because we think about ovulation should be on day 14, but it might happen a little early, might happen a little later. You have to get to know your cycle. Day 15 to 28 is the secretory phase. The endometrium is ready to receive the embryo. You have high levels of progesterone. The functional layer becomes a secretory mucosa in that the endometrial glands are going to secrete nutrients into the uterine cavity, and these nutrients are to help the embryo to stay alive until it implants. And then at this time, and this may be 2 or 3 days after ovulation, it may not happen until 5 to 7 days after ovulation. Each woman is just a little bit different, but during this phase, the mucus becomes at the cervix becomes very thick, and it forms a mucus plug, and that is there to block sperm, pathogens, debris, whatever. It's there to really seal off the uterus so it becomes a healthy place for the baby. Okay. If fertilization doesn't occur, then the corpus luteum begins to degenerate. Progesterone levels fall. The spiral arteries spasm. They kink up and they spasm. Endometrial cells die because they don't have any blood flow. And then as the spiral arteries constrict again, they relax, they open up really wide, and this causes a rush of blood, and that into those capillary beds, and that shatters those beds and that tissue so that the blood vessels fragment. They don't explode exactly, but they go poof, and the functional layer begins to slough off. And then you have about 3 to 5 days of bleeding, and while that old layer is being sloughed off, then the stratum basalis begins to undergo stimulation for proliferation. So here we go. When we let's look at this. This picture, figure 27, 25, is going to show you how the uterine phase and the ovarian phase and all the hormones interact. So I would encourage you to take the time and really study this. If you're tired, then you need to pause this lecture and go take a break and then come back and get ready to focus. So what we have here in the uterine phase, remember that day 1 is the first day of bleeding. And you see that it's in the light blue. The darker blue is the proliferative phase, and the green is the secretory phase of the uterine phase. So you have menstruation, so you've got gonadotropin levels are fluctuating, follicle stimulating hormone and luteinizing hormone. Okay, these are going to be low. But what we see is that during the proliferation phase, notice that luteinizing hormone peaks about day 12, 13, 14, okay? And as it peaks, notice that FSH has a little bit broader peak, All right, it's not quite as much of a jump, and it lasts over a few more days. So you've got follicle stimulation taking place. Luteinizing hormone has a very high rapid peak, and remember, with luteinizing hormone, then we're going to have ovulation. Ovulation. Look at FSH. Notice it has a little bit longer peak, and it stays at higher levels. All right. So how does this correlate to the ovarian phases? Let's look at this. During the menstrual phase, ovaries are going, yeah, we're done. But FSH and LH start to increase, and what do we see during the proliferative phase is the follicular phase, or in other words, the follicle, the dominant follicle is going to mature and get ready for ovulation. At toward the end of ovulation, toward the end of the proliferative phase, then what we see is ovulation about day 14. And then that's the proliferative phase. And then the corpus luteum is formed, and remember, it's producing progesterone. And so as it produces progesterone, we have the secretory phase. So the secretory phase and the luteal phase coincide. The proliferal phase and the follicular phase coincide. If implantation does not take place, if fertilization does not take place, then the corpus luteum is going to degenerate into the corpus albicans. Progesterone levels are going to go down. So here we are in the uterine phase, and we're looking at estrogen and progesterone. Notice that in the secretory phase, progesterone has its biggest increase. Notice in the proliferative phase, in the secretory phase, estrogen peaks twice. It has its biggest peak right before ovulation. And then it goes down, and then it peaks again in the secretory phase. Okay? So, what's taking place here? Think about what's taking place. We need, excuse me, we need for the ovary, not the ovary, we need for the ova to mature and ovulate, and then we need the endometrium to be nice and juicy and ready to prepare, ready to receive the embryo. And so this is what's taking place. Remember that LH and FSH are low during the secretory phase, right? They peak during the proliferative, right before and at ovulation. So looking at the endometrium, what do we see? So you have the beginning of menstrual phase and the menstrual flow, and we see that the functional layer decreases dramatically. The basal layer doesn't change. During the proliferative phase, then we see an increase in the proliferation of the basal layer to make the functional layer. Look at day 14. The endometrium, the functional layer, should be thick, it should be full of blood, and it should have nutrients in it, and so it is ready to receive the embryo. It's ready to receive the embryo. So when we look at this all together, let's look at this all together. Note when LH and FSH peak. They peak just prior or right at ovulation. Okay? When does estrogen first peak? Right before ovulation. So 3 hormones that peak just prior to ovulation are luteinizing hormone, FSH, and estrogen. When does progesterone peak? Progesterone peaks when the corpus luteum, that's the luteal phase, when the corpus luteum is formed and producing progesterone. What is that in the uterine phase? That is the secretory phase. That's the phase where the functional layer is the best. It is ready to receive the embryo. Does estrogen peak twice? Yes. It peaks, notice we're talking about plasma level here. It peaks just prior to ovulation, goes down, and then peaks again during the secretory phase of the uterine cycle, and that's the luteal phase of the ovarian cycle. Remember, the luteal phase and the secretory phase match up. Okay, the follicular phase and the proliferative phase match up. So what this means is that God has put everything in place so that the little embryo, which is only a few cells big, has the best environment possible in order to grow into a fetus and eventually be delivered as a baby. What are some of the problems? Mainly, we notice this as whether or not the uterine cycle or menstruation is taking place appropriately. If you have very little body fat, ladies, then you may go into amenorrhea, which is you don't have menstruation, you don't have a period. This is due to the fact that our bodies are geared to know how much fat, adipose tissues, we have, because adipose cells are needed to convert the adrenal androgens to estrogens and produce leptin, okay, in order to get our bodies up and running. And so a lack of leptin, which is from the fat cells, causes the reproductive cycle to stop. Why? Because the body thinks that we're starving, that there's not enough food. And if there's not enough food to have the proper amount of body fat, which is around 18 to 20%, is considered, your body considers adequate body fat in order to reproduce. Also, if we see that we're more morbidly obese or more, that can shut down the cycle because it's a sign of ill health. But most of the time, what we see is that women who are very physically active have less than 18% body fat, then usually don't have a period. They don't have a menstrual cycle. And some women do this on purpose so they don't have to deal with menstruation. The thing is, menstruation is a characteristic of health, of good health. So if you don't have enough body fat, your body says we're starving, and that is ill health. So let's look at these hormones, and you need to know Estrogen, progesterone, testosterone, the major source, what stimulates the release of each, are there negative or positive feedbacks, and then what's the effect on the reproductive organs. So this is very important information, and I ask you to study it and to especially know the effects, okay? Especially know the effects. What happens? What happens? All right. So estrogens, progesterone, testosterone. When we look at secondary sexual characteristics, it's estrogen in females, of course, testosterone in males. Metabolic effects. Why is it that when our estrogen peaks, we gain weight? That's because it inhibits diuresis, okay? And we gain water. Why do we need water? Because we're getting ready for that little embryo to implant and start sucking nutrients, well, literally sucking the life out of you, all right? What we do know is that estrogen is partially responsible for our sex drive. And ladies, that's why right around the time of ovulation, when we have a peak in estrogen, we feel good and we like ourselves and we feel pretty. In other words, estrogen makes us horny. And you can watch your friends and kind of figure out when they really start to dress up, they really start getting flirty. Uh, this is all behavior, reproductive behavior, to find a mate and reproduce. Now, guys are always in a sex drive. They are usually looking for a mate. And I have stories about young boys. By that I mean young teenage boys, 13, 14, 15, who just didn't know what to do with their sex drive, and so they put their penis in various and sundry holes. Things get stuck when the penis undergoes erection. Can cause all kinds of embarrassments, not only embarrassments, but trips to the emergency room can be dangerous. Okay? Progesterone promotes diuresis. Yay! It also increases body temperature. It's interesting, huh? Okay. So let's think about estrogen is also very important for our bones. Okay, and I love this. Promotes female body pattern of fat deposits. It's responsible for our curves. Women are supposed to be curvy. They're not supposed to be bean poles. Of course, everybody's a little different. All right, if you want to take another break, this is a good time. We've talked about the male sexual response, and males is just a fact that males are far more easily sexually stimulated than females. Females respond to touch and psychological stimuli. Males are much more visually oriented. We look at once a female is sexually aroused, the clitoris, the vagina mucosa, the bulbs of the vestibule, the breast engorged with bloods, and the nipple becomes erect. And the nipples can become erect if you get cold as well. So the gland, the vestibular gland secretes lubricant. So we want to lubricate so that the penis slides into the vagina smoothly. Orgasm can be accompanied by muscle tension, increase in pulse rate, increased blood pressure, and rhythmic contractions of the uterus. Males have an easier time of reaching orgasm and then ejaculate. Females, on the other hand, may or may not reach orgasm. Remember that males have a refractory period after ejaculation, and they have to wait a little bit before they can go again. Women, on the other hand, have no refractory period after orgasm and can have multiple orgasms. Orgasm's not necessary for conception. Orgasm is mainly pleasure.